I don't shop at Whole Foods unless for fresh fish. I don't buy organic. I wouldn't buy raised with antibiotics unless it was the same price as conventional. I really don't care about that stuff. We can't feed the world going back to the good old days of the small farms. We just can't do that. Hunger is a bigger problem than antibiotic resistance. Unless you have pneumonia and it's an antibiotic-resistant bug, then that's a big problem for you. So we need to talk about what we can do to reduce antibiotic resistance. And the first thing I want to tell you from an MD standpoint is antibiotic resistance is growing. It's getting more and more serious all the time. USA Today had a story about endoscopes. You think getting an endoscopy is a relatively benign procedure. People are dying from that because of carbapenem-resistant Enterobacteriaceae. If you get that bug, you have a 50-50 chance of dying. And that's just from an endoscope to see if you got a cancerous ulcer or something like that. We're not talking about open heart surgery. We're talking about going in for an outpatient surgery, and people are dying in this country because of that, in large teaching facilities where they use the utmost of care to be safe. So speaking of superbugs that kill people, I want to talk just briefly about, well, first we'll start with slime. This shows you what the media can do to your product if they decide to fight you. It could be antibiotics, it could be ractopamine, it can be whatever you're using in your industry. You can be attacked relentlessly. And if you have one network that will run the story 23 nights out of 30, you will lose a product that's been in the business for 20 years. This is in the beef industry. Finely textured beef was used for 20 years to get approximately another 12 pounds out of every cow. Kept our ground beef leaner, kept our ground beef cheaper, went away after 1 month. The public didn't want to eat that stuff anymore because it sounded awful. And it wasn't. It was safe. It was very safe, very nutritious, helped feed the world. But it's gone. 600 people lost their jobs at the height of the recession. Now, let's talk about a superbug called MRSA, methicillin-resistant Staph aureus. And I bring this up today only because the pork industry is getting accused of livestock-associated MRSA colonizing people that work in some of the facilities where you're raising your swine. And that's one of the things the media is trying to push. And the advocates who don't want us to slaughter animals for consumption are trying to push this is a bad way to raise pigs and people are going to die from MRSA. Well, let me tell you this. Penicillin was first used in the late 40s, and by 1950, 40% of all hospital isolates of Staph aureus were already penicillin resistant. Penicillin wasn't used in the animal ag industry yet at that time. By 1960, 80% of all isolates were resistant. We had a real problem trying to treat Staph aureus. So we developed methicillin, which was first used in 1959. In 1960, the first case of methicillin-resistant Staph aureus was found in a human being. Methicillin had never been used in animals. Staph has an ability to mutate very quickly and form resistance. It's not because we're using penicillin in animals. This is just the nature of the beast. In fact is, we're doing a very good job of fighting MRSA with the CDC's help. Hospital-acquired MRSA is down 54% from 2005 to 2011. There have been workers colonized with MRSA, but there's not been one case of a human infection of livestock-associated MRSA in this country, ever. It's just not an issue. I just give you this for ammunition when you're talking over the coffee table about, is this a problem with livestock-associated MRSA? No, it's not. In fact, maybe we gave them their MRSA and colonized them. It happens all the time. This is not a new phenomenon, bacteria going back and forth from animals to humans. West Nile virus, SARS, monkeypox, you name it. It happens all the time. It's not new. So, plain old penicillin. I read in the paper all the time from some of these advocates for not slaughtering animals saying kids will start dying from strep throat again. Wrong. Penicillin is still the drug of choice for strep throat, even though we've been using it since the late 1940s. Strep didn't develop resistance to penicillin. Staph did. It wasn't because of misuse, underuse, or subtherapeutic dose, or the patient not taking their medicine. It's because the nature of the beast, and we don't understand resistance all that well. So let's talk about some numbers. These are the numbers you hear all the time. Congresswoman Slaughter, who wants to get PAMTA passed, which would take away antibiotics for control and prevention, says repeatedly that 80% of all antibiotics sold in this country are sold for use in perfectly healthy animals raised for food. And so those of you who have heard my talk before know that there's a footnote underneath every graph or every table in the annual report that comes out from FDA about antibiotic sales that says these antibiotics are also used in companion animals such as horses, cats, and dogs. And they're also used in sick animals, of course, so it's not perfectly healthy animals raised for food. I can put up with Slaughter saying that all the time, but when I read a report that just recently came out from Princeton University, with co-authors from Belgium, Brazil, Canada, and other countries. This is supposedly the big thinkers of the academic world talking about the global increase in the use of antibiotics, and I'll talk about that in just a minute. But the first paragraph of this document that everybody's quoting right now says, in the United States, I quote, in the United States, antimicrobial use in food animals is estimated to account for 80% of the nation's annual antimicrobial consumption. They can't even read the footnotes. I mean, automatically, that discredits that paper. The footnote says, no, it's not just animals raised for food. So we got to fight that number, and that's that media, that's that pink slime, that's that image of 80% of all antibiotics. Liz pointed out to me earlier today, she said, you know, tetracyclines are 70% of all the antibiotics used in animals that are used in humans, and if we would just prescribe doxycycline instead of chlorotetracycline, we could cut that number down to 87% because it's all by kilograms. In the humans, I don't know about in a pig, but in a human, a dose of doxycycline is 100 milligrams a day, but if you get chlorotetracycline, it's 2 grams a day, and that's how we would measure the use. So it's the numbers, but the numbers are all we have. This is the latest report. It came out a few months ago for 2013. They've had 4 reports now. We compare report to report to report. You can't read it from back there, but right here, here's the footnote that says this includes companion animals. This year they broke it down. They changed. It used to just be all the antibiotics. Now they got it. These are the antibiotics from here up to here that are used in humans and animals. These are antibiotics used just in animals. Of all these antibiotics used in both animals and humans, 71% were a class called tetracycline. You ask your doctor, don't trust me, just ask your doctor when the last time he or she prescribed chlorotetracycline was, and they'll ask you if they still make it. It's just not used very much in human medicine. Extremely rare cases, usually is a very poor second choice. The ionophores down in this group constitute 79%, and I know that ionophores aren't big in the swine industry, but it's big in bovine and poultry. So that's a lot of antibiotics that are not used in human medicine ever. Very toxic to humans. You'll never see it approved for use in humans. There's no cross-reactivity. The Pew Charitable Trust says we don't care about ionophores. There's no science that can affect us. We care about those ones above the line. So, and I mentioned kilograms versus milligrams is a big, but it's the only numbers we have, so we have to use them with that compatibility. I don't know why the FDA insists on labeling that report antibiotics sold or distributed for use in food-producing animals. They just feed the media with a very bad label. Ionophores were 30% of all antibiotics used. They're parasitics, not individually reported or almost all used solely in animal medicine. And tetracyclines are 44% of all antibiotics sold for use in animals. That leaves 18%. 18% of antibiotics used in animals are also used frequently in humans. These are the top 5 classes in human medicine. And I gave examples of brand names, so it might help you. I don't want to make you a doctor or a nurse practitioner, but to help you understand. Penicillin, number 1, by 44% of all antibiotics in humans. Augmentin is probably the most common, or amoxicillin. If you got children, they've taken that. Cephalosporins, sulfurquinolones, and macrolides. These make up 88% of all the antibiotics used in humans. This is the 88% I think we ought to take a look at. I want to point out quinolones and cephalosporins, number 2 and number 4, comprise 0.3% of all antibiotics sold for use in animals. The FDA is doing a good job of protecting our health as humans. They have dramatically limited fluoroquinolones and cephalosporins most recently for use in food-producing animals. These are almost only used in companion animals and in very small amounts, and that's 25% of human antibiotics. What are the other antibiotics classes used in humans that are also used in animals? Again, 71% are tetracyclines. The rest of these are relatively low use in animals. And if you like graphs instead, the graph on the left, the yellow, is 82% of the total volume sold for animals. This is how much is used in humans. This is 68% of the total sold for humans. This is how much is used in animals. The only place where we really come close to being about the same is the macrolides. Macrolides are used in cattle in feedlots to prevent liver abscesses. Gets more value to return production-wise for the feedlot operator. It's not an animal health issue, but you can't sell the liver and you can't sell some of the muscle where it might be scar tissue. So the producer loses a little money at the sale. So they feed a macrolide. Prevents it. We have alternatives, but they cost a little more money and they're not quite as effective. It's one area where we can make some dramatic improvement, I believe. Macrolides are Z-Packs. Half the people in this room are probably taking a Z-Pack in their life. It's 1 pill, 5 days, done. drug of choice for community-acquired bronchitis, community-acquired sinusitis, and many rickettsial diseases, and I would like to see it keep working, so when I get my sinusitis, my bronchitis, it will work. I would like to see it eliminated, removed, reduced in animal use. The latest report, that FDA report I just showed you the title page for, just came out about a month ago. It's for 2013. It's a little late, but that's the best we can do. The actual sales of antibiotics used in animals went up 1%. Congresswoman Slaughter, the Pew Charitable Trust, Johns Hopkins University, they all said, you see, the voluntary removal of antibiotics for growth promotion just isn't working. It has to be mandatory. Liz Wagstrom was quoted, and I can't remember which paper, she says, it hadn't even got into effect yet. What are these people talking about? And I love that quote. I can't remember where I saw that, but I thought, yes, got somebody fighting for the industry. That goes into effect. Steve's going to talk about, or Scott's going to talk about that later, so I won't get into that. But to say because it went up 1%, the sky is falling down is wrong, because remember that class, those 5 antibiotics classes? Well, the macrolides went down 9% that year from the year before. Penicillin went down 14%. Sulfa went down 22%. The fluoroquinolones and cephalosporins, you remember, that's that little 0.3%. That's not even worth measuring. So of the 5 categories that make up 88% of all antibiotics used in human medicine, they all went down considerably. The only thing that went up that gives that 1% was tetracyclines went up 9%. Well, if you represent 71% of all sales and you go up 9%, you're going to see the total sales go up. Again, the important antibiotics went down. 1 year doesn't mean anything. But I hope this is the start of a trend, because this is going to get a lot easier to defend if every year we see the use of those antibiotics used in human medicine, of significant use in human medicine going down. We're going to win this argument. This is good fodder, but you don't see this in the newspaper. You see the 1% increase, and that's all you see. So now you got some information you can take to the coffee table. So why is this change? I mean, and this is, and Mark's talked about this. This is a huge perception. Antibiotic use is growing. The media coverage is growing, and now we got the president involved. I mean, it's big time. Several people in the room here were at that meeting in D.C. on Tuesday. I've enjoyed listening to comments about that meeting. We'll see if we can get that in a question and answer. But I already said this is not a joke. Antibiotic resistance is increasing, and more people are dying from it. But almost all of those deaths are coming from hospital or medical facilities. They're not coming from eating pork. So it's a factor going up. So why is the community concerned about this? Well, when Chipotle, Chick-fil-A, and Panera, and all the Costco, and all the ones that Mark already showed you say, with their announcements, we're going to serve up only animals raised without antibiotics, or we're going to sell only animals raised with antibiotics not used in human medicine, or whatever phrase, however they're catching this. The average consumer has to take a look at those huge corporations with millions of dollars in assets and think, God, they must know something I don't know. They must have researched this. So I guess they must be right. And the farmers who are trying to make money must be wrong. And so they're going to go that way. The recent announcement by Costco and McDonald's that their animals will be raised without antibiotics used in human medicine, I believe is a good move, especially in the poultry industry, because it's fairly easy to do. And they're not seeing a rise in costs. They're not seeing a rise in animal wellness issues. They'll still give antibiotics when they're necessary. They just go into conventional. They don't even try to explain. But worse, they're going to use ionophores. The only label that the USDA has right now to separate those two products is raised without antibiotics except ionophores. Now, the average millennial is going to say, what the hell is an ionophore? That must be one of those hormones that give the chickens a big breast, so I'm not going to buy that stuff. So to say raised without antibiotics used in human medicine is a good marketing tool, but they can't put it on the label. They can advertise it. If you come to McDonald's, you'll only eat chicken sandwiches raised without antibiotics used in human medicine, but they can't put it on the label in the grocery store yet. So anyhow, I think the average consumer will take a look at these labels and look at the price and then decide, is it worth $2 more for this or not? There are some that will say, yes, darn right, it's good for the environment, it's good for my kids. But they may or may not be wrong, I don't know. Then we have this group of the largest school boards in the country, Dallas, Chicago, New York, Seattle, Los Angeles, all get together and say, our schools will only feed poultry to our kids that were raised without antibiotics, period. No ionophores, no antibiotics, period. Even though the supply isn't out there and even though it's going to cost more money, I don't know what they're going to do for their school board budgets, maybe cut out computer classes or something. I don't know. They're going to have to pay more money for this chicken. They didn't take that into consideration. But again, people think, well, these are educated men and women. They must know what they're talking about. And then you start getting the larger cities in the country passing resolutions that all animals in their state should be raised without antibiotics. Are they representing the average person living in the slums of Seattle that can't afford to put meat on the table? No, they're not representing their constituents at all. They're doing a feel-good thing. And they ought to be bumped out of office. Talk real quickly about superbugs, and we'll save time for question and answers. In reality, almost all superbugs, a superbug is a bacteria that's resistant to the antibiotics that are commonly used to treat the disease. Period. Most superbugs come from health care facilities, one kind or another. No question about it. We do have multi-drug resistant salmonella. The recent Foster Farms outbreak in the West Coast was multi-drug resistant salmonella. More people were hospitalized than average with salmonella infections. So therefore, the media, Slaughter, Pew, and all the other ones said, you see, that multi-drug resistance is because they used antibiotics, so therefore the people landed in the hospital. It's a superbug. We need to stop using antibiotics. The truth of the matter was that the antibiotics so salmonella were resistant to were gentamicin, tetracycline, ampicillin. Antibiotics would not be used to treat a foodborne illness. All of those samples that were taken were still sensitive to macrolides and ciprofloxacins and Bactrim, the 3 drugs of choice to treat salmonella. It was just a more virulent bug. The drugs worked. It wasn't because of the use of antibiotics that this was a bad outbreak. But that was the perception. Now we got these reports, and Mark's already talked about the PCAST report, and we got the National Action Plan, and then we got NIAA's white papers, which are really good reading material. Now we have the newest report that came out from the Tuesday meeting that we'll hear about later today, I'm sure. But these reports all keep it in the front of the public's eye that we've got a problem. This is the National Action Plan. I'm going to skip over that now so we have time for question and answer, and we can address that during Q&A if we need to. But basically, part of this is calling for advanced development and use of rapid and innovative diagnostic tests so clinicians, veterinarians, and MDs can tell if that infection with the fever is a virus or is a bacteria. We can markedly reduce the amount of antibiotics we use with better testing. When I started practicing medicine in 1973 and a kid came in with a sore throat and a fever, we swabbed the throat, sent it to the state lab, gave him penicillin for 3 days, and then found out if it was a virus or bacteria. We can do this for all infections eventually. And this one has developed more antibiotics, possibly for use just in animals and not crossover. It's a global issue, and the Princeton report came out, I already told you about, but in their report they do say antibiotic consumption in animals will rise by 67%. And they had an early report that said antibiotic use in humans had risen by 36% in 10 years. That's a problem with that kind of growing use of antibiotics.